am friendly MC for our monthly APA meeting. This month's topic is nobody's health benefits are safe. Learn the solution. I'd like to welcome you all here. Do we have any new members? Do we have any elected officials or people running for office?
Hi. Hi, everybody.
Before we proceed, we should point out to everybody that this meeting is being recorded and will be publicly available on YouTube. So you should consider what you're going to say before you say it, if you are concerned that maybe not everybody should hear it. All right?
Did everyone hear that? Okay, great. Would you please
Yeah,
stand
of
and
course.
introduce yourself?
Hi, everybody. I'm Mike Griffith. I've met a lot of you, but I certainly haven't met everyone. This group continues to grow, and it's amazing. You're up 100 and how many members now?
A lot.
Yeah. Yes. So Mike Griffith running for the at-large seat for Arvada City Council. The election's November 4th. I'm happy to answer questions after the meeting. Thank you so much.
Thank you, Mike. At this time, I would like to pass the bucket for donations. We as a group have monthly bills that include rental space and MailChimp and all the things we do to try to stay organized. So if you could donate, that would be great. I would like to ask everyone during these unprecedented times in the United States is what gives you hope? What keeps you going? And I will be the first one to answer this group. Okay, this group makes me able to know that there are people who are actively participating in keeping our democracy healthy and active. And we are committed to nonviolence, and that gives me hope because I think the further it goes along, the more violent people, the more people may want to become violent. And I think it's important that we who believe in nonviolence stand up. Joyce.
I was delighted to read today that J.B. Pritzker has laid out exactly how the Trump goons must act in Chicago or anywhere in Illinois. They may only protect federal buildings, and if they deviate from that, they should be okay. So it gives me a lot of
Yay!
Oh, he's the governor of Illinois.
Yeah.
And will the courts hold to it?
Well, it's a state thing, so
Okay.
Maybe
Let's
he'll
get
go
some-
more if he wants.
So also one of the things the mayor of Chicago has done in coordination with the governor is pull out all the salt trucks they use in the winter to line the roads and block because they're huge. So that is called nonviolent resistance. And those are things we have to be creative about doing. Yes, Mindy.
I'm happy that Gavin Newsom is trolling, his people are trolling Trump. I mean, you know, not that I'm going to vote for him for president, but the fact that someone's dishing it back to that guy.
Yes. I see lots of things to be hopeful for during this very dark time. We also talk about what keeps you up at night. I don't even know if we need to talk about that because everything, right? But this is a hopeful place. We are here for each other. We are a group that has action teams. We are progressive, Arvadans for progressive action, which means we do things. So at this time, I'm going to introduce each of our action teams so they can give you a synopsis of what's going on. We have a communication team that is led by Liz. She is not available today. Next, we have education, Mindy.
Well, actually, I'm subbing for Allison Phipps. Allison Phipps leads the education team, and she wanted me to let you know that there are 3 seats available for the board of the education Jeffco School District Board, and they will be having a forum, and apparently all candidates said they will attend. So the forum will be Monday, September 29th from 6 to 8 p.m. So mark your calendars, the 29th, 6 to 8 p.m. It'll be at JUC, the church off 32nd near Golden. It will be live streamed and recorded afterwards, but you know, still showing up if you can in person is really wonderful. Get questions asked and to see how the school board candidates answer those questions. We have 3 that are endorsed by the Education Association. The affordable housing and homelessness side, the city of Arvada finally is starting their community conversations on homelessness. So if you indicated ever to the city you were interested in homelessness, you should have gotten an email. They were having 4 sessions in different dates in September, so you can attend one of the 4. If you didn't get the email and would like to do that, you can contact me, Mindy Moore. My email's on the APA website, and I can forward the invitation to you. Oh, yeah.
Could you say the times and the location again for the 29th?
It's Jefferson Unitarian Church
Okay.
on 32nd Avenue.
And what were the times?
It starts at 6.
Okay.
Yeah, Bob.
Has the city agreed to do anything about affordability or affordable housing in a community?
The city's doing a lot on affordable housing. It's the navigation center and homelessness that is still under discussion. But affordable housing, they just opened up, did groundbreaking for 20 Habitat for Humanity townhomes on land that the city donated, 52nd and Carr. There's a bunch of affordable housing going in on Marshall Street. Permanent affordable housing is going in. So I'm really pleased with what the city is doing on affordable housing. They're meeting their commitments, and they're also, it looks like there'll be some apartment buildings in West Arvada. There's like 3 different developments that are being proposed. So actually people don't have to buy mega mansions to live in West Arvada. Some of our workers and our seniors can actually have more affordable housing and apartments out there. So that part's good.
Thank you, Mindy. So that was
Mindy,
Mindy.
I'm sorry, I just wanted to mention that the groundbreaking for the affordable housing project on Marshall is October 8th. I think it's at 3 p.m. That's a huge project. It's going to be a really cool ceremony.
Thank you.
Also, I have a note here from the Ethernet. Kathy Jackson says an item that gives her hope is that the Arvada Harvest Festival had a float of the Rising Church. This is the church that is helping homeless people in Old Town Arvada, and she heard people cheering as it went by.
Yay. So that was Mindy, who gave an update for education and affordable housing. Next, we have Bruce for anti-war.
Hi. As you probably know, the war situation is dire. Senseless wars continue, Ukraine, Sudan, other places, and the genocide continues unabated in Gaza. Gaza City is being destroyed, the West Bank is being annexed. Plans to purge Gaza from Palestinians to build resorts are on the books. All Colorado members of Congress, including all the Democrats, are fully in support of more weapons for genocides, offering only calls for humanitarian aid to the surviving. No condemnation, no opposition to weapons for genocide. I know there's a lot to call our members of Congress about, but please find a space for a demand they oppose weapons for genocide. And many of us are involved in the Democratic Party. I ask you to please bring up the genocide in Gaza. The party needs to know that their failure to stand up to genocide is a profound moral and strategic blunder. There are some cracks in the support for Israel and for this tragedy. A candidate for Senate in Maine got a 30-second standing ovation at a large Labor Day rally for criticizing these weapons that are going to aid what's happening in Gaza. Okay, the anti-war team handed out cards at the farmers market in Arvada. Our next meeting is this coming Monday at 6:30. What?
Where?
That would be at my house, 6521 West 69th Way.
Thank you, Bruce. Next, we have climate. Scarlon.
I take your seat. That's fine. Okay.
Hi, thanks. I'm Darlan, and I was just asked by Mindy to ask everybody here Are you getting the emails from APA? Because a lot of these events are being put in the email so that you can get the.
Do you get those weekly emails? Okay, if you're not signed up, please fill the form out so you get them, because a lot of these locations, meetings, times are in those weekly emails.
So with the climate action group, we're trying to help out the Jeffco students and parents for climate action to get the Jeffco school board to have a climate action plan within the school's documents. And to make that happen, a number of people from Jeffco students and parents for climate action will be at the September 29th meeting to ask the candidates for the Jeffco school board what their stance is on climate action. So this will be a great opportunity too, if you go to that meeting, to support the Jeffco students and parents for climate action. We have 4 very dedicated seniors in Jeffco schools that are doing all they can to get their schools to speak up and to get the school board to move in this direction. So that's a really important front that we're pushing on climate action. The other important front is on getting the Arvada City Climate Action and Sustainability Plan to be voted on by City Council. And that looks like it's going to be happening in January or February. So it'll be after the election. So the people that get elected to Arvada City Council are going to make a really big difference as to whether or not this climate action plan gets supported unanimously. We want a unanimous vote, not just a majority vote, because that would significantly increase the chances of it getting funding and getting priority among the city's many different plans. And a big part of that is the communities being able to support that. And my community is actually going to be putting out the call for volunteers to speak out at city council meetings leading up to the vote in order to ensure that we get a unanimous election. So thank you for your time.
Thank you, Darla. Next, we have political action with Joyce.
Hi, Joyce Richardson here. Political action is busy this year. The endorsement survey is out. The due date escapes me, I'm sorry to say, but all of the city council people are facing opponents as of now, and the ballot should be set now because the deadline was the 25th. So please check our website. I think all but one of the candidates have filled out our questionnaire. So it'll list the question and you will be able to see their responses. If you find somebody that really turns your crank, please donate to them and work for them. It's important to have a progressive city council. We've made a lot of strides in that, but we want to keep going. There will be a vote on a change to the Arvada City Charter that affects where judges can live. Right now, the charter says the judges have to live in Arvada, it's become untenable. And they are going to change the charter so that municipal judges that are hired either as a judge or as a sub need not live in Arvada. It's just been almost impossible to find substitute judges, and that's not a good thing. So I personally would urge you to vote for that, but the endorsement survey will tell you how people feel. Rumor has it that there are 2 statewide referred measures that came out of the special session. So watch the website for those. I will be looking at those as soon as they hit the Secretary of State's website. I looked yesterday, couldn't find really any information. So I will let you know via the website what they are and try to post some links to groups who have an opinion on that. And so keep looking at the website. It's got lots of political information. Thanks.
Thank you. Nancy is the leader of our rally team. She's not here today. Watch the web or the email for upcoming rallies. Pat, if you'd like to go next for immigration protections.
You weren't doing.
I'm gonna do last and then I can just pass it off.
All right.
If you're not ready, that's okay. I'll go ahead.
Okay.
My name is Julie. I'm Social Connections. We've tried to get together often in the last few months because of all the stress of feeling very isolated, which is what authoritarian governments try to do, is make you feel alone, and you are not alone. So this coming up on 9/13, we're going to have a Saturday morning coffee. We're gonna start at 8 and it's going to be at the Colorado Tap House. We're gonna start from 8 to 9 and we're gonna go for a walk. At 9 o'clock, we're gonna be back for coffee. So if you'd like to walk, meet me at 8. If you don't wanna walk, be there at 9. I'm looking at 9/26, that wasn't one of her things, right? 9/26, which I think is Monday night. We're gonna have a happy hour if we make it through the month of September. I will keep you posted on times and dates on that. Also, this Wednesday night, which is 9/10, there is a meeting at University of Denver. It is a leadership meeting, a public forum, Mamdani's election campaign lessons for Colorado progressives, September 10th at 6:30 at Maglione Hall, University of Denver. They asked for an RSVP. But I will be going, and if anybody would like to carpool, let me know. It is from, I believe, 6:30 to 7:30. And that is it for Social Connections. Next, I would like to introduce Pat for immigration protections.
And also timing. So your speakers need to know that. That didn't get mentioned. So I just want to, and I'm going to time myself. Okay, so I am the lead for the Immigrant Protection Team, IPT, sorry. And that was formed in November of last year. And, oh, I have last month's notes in front of me. Okay, so they're not that different from this year. The team, which has about 185 people, is doing a lot of really good work. Going to Denver. Oh, I need to hit the start button, don't I? Yeah, we're ahead of schedule, actually. So there's court watch every day of the week in Denver at the immigration courthouse. And we're there. Not everybody is bilingual by any means, including me, who show up. But the people who are there for appointments, required appointments, are also at risk of getting picked up there. So we're there, we've got our volunteer sign on, letting them know we're not the government, and they know we're there to support them, to be behind them. We don't interfere if ICE should, go after them, and that hasn't happened since June, but we're there every day of the week. Another important thing we're doing, and I'm trying to find more opportunities to help individuals or families. We have 4 members who helped out with a woman who is here waiting for her asylum process. And she's been going to computer training and she's been taking the bus. Well, she's, that's risky now. She doesn't feel safe. So 4 members stepped up to take her, so there's a whole schedule of people coming and go. Oh my gosh, my time's almost out. Okay, so back there are some red cards. They're called Know Your Rights cards. If you are comfortable handing those to people who might be at risk of being picked up, which is a lot of people. I mean, looking around the room and I'm not seeing people who might get picked up, but we know they're out there, and those are our neighbors, our friends, people who do service work for us. They're our neighbors. So grab cards, and there is a rapid response network phone number on there that you ought to put in your phone under your contacts. So if you see, or anybody in your life sees something they think might be an ICE action, report it. And then they have a whole system for people to confirm whether it is or isn't. Anyway, thank you.
Thank you, Pat. Just to reiterate what Pat said, the speakers. Oh, yes, ma'am.
I just wanted to follow up on what Pat said. Some of us are going around to businesses with sheets explaining what their rights are as businesses. ICE has to have judicial warrant in order to enter a business, unless they have permission. And I just started doing it. Karen Usry, who I'm not sure is in this group, has done a lot more than I have. But I just wanted to say the responses I've gotten have been really encouraging. So if anybody wants to do that, maybe this will take some of the intimidation out of it. People have been really happy to get the information that I've given them and very welcoming. So there we go. Thank you.
I would like to reiterate that our speakers, there's a timekeeper, and watch her to let you know how much time you have left. Now I would like to introduce Kathy, who is our health team leader, who is hosting today's meeting. Thank you.
Thank you, Julie. Good health underlies participating in activism and in life. So I want to appreciate that you guys are here. First, I'm going to tell a little story. Senator Jeannie Nicholson's 10-year-old granddaughter, whose name is Hazel, had severe anemia and was so tired she couldn't stand up. Am I loud enough? Not better?
A little more.
Okay. She needed blood transfusions often. Doctors recommended an expensive drug, but she had to wait because of prior authorization. Fortunately, she eventually got the drug and is okay today. When insurance companies delay or deny care, people suffer and can die. In today's talk, we will balance new challenges with reasons for optimism and how you can help. The sign back here was made by my mom in 2016, and it's just gotten worse. The big ugly bill saddled Colorado with a $1 billion shortfall plus. Adam Fox, Deputy Director of Consumer Health Initiative, will share the details of the bill's devastating impact on health coverage. Thank you. Adam works with healthcare stakeholders, policymakers, and government officials to benefit consumers and to focus on equity in healthcare. Now we're getting to the solution. The solution to this challenge is a single-payer healthcare system for Colorado. It would be a nonprofit, publicly financed health system based on 10 essential elements. I'm going to show a 2-minute video which will explain what you can expect under this system. Healthcare reform efforts have been happening for a number of years now, but recently healthcare reform groups have come together to form the Colorado Healthcare Alliance. This gives me hope. Started by 6 Colorado statewide and local organizations, including Arvadans for Progressive Action, the Alliance meets on Tuesdays. The Alliance was successful in passing Senate Bill 25045, which directed the Colorado School of Public Health to create a single-payer universal system model. Senator Marchman will go into detail about how we get to the solution. She was a sponsor of the bill, and she was elected from Boulder and Larimer County. She is currently a teacher in Loveland and is dedicated to serving the needs of people that are struggling under financial hardship, including working families and retired people. There will be time for questions at the end after the speakers. If you are on Zoom, please put your questions and comments in the chat. We will close with action choices, how you can make our vision a reality. And on your chairs, I have some flyers about the single payer, and I also have actions you can do. But right now, I'm going to give it to Adam.
Should still work here. All right. Good afternoon, everybody. Thanks for having me. My name is Adam Fox. I'm the Deputy Director at the Colorado Consumer Health Initiative. I've worked at CCHI for over 14 years in different roles, which means I am a resident health policy nerd in extreme. CCHI, for those of you who aren't familiar, we're a nonprofit, nonpartisan membership-based organization that really works so that all Coloradans have equitable and affordable healthcare, and we do believe in universal healthcare. We serve Coloradans whose access to healthcare encounters a variety of systemic barriers and the unfair business practices of our healthcare industry. We run a consumer assistance program that helps folks navigate medical billing issues, insurance claim denials, access hospital discounted care, all of the sticky things in our healthcare system that really shouldn't exist. And so I'm going to talk about HR1 and the impacts it's going to have on Colorado, which unfortunately is not a very fun presentation to have to give. But we need to start sort of with what funding Colorado gets from the federal government. There are some additional slides in the slide deck around TABOR and the Taxpayer Bill of Rights and how that plays into this. But we're going to focus on sort of the federal funding side of the equation to start. Colorado gets over $12 billion in federal funds, and that goes to a variety of services that the state provides. But the vast majority of that, over $9 billion, goes to our Department of Healthcare Policy and Financing, which provides Medicaid and the CHP Plus program for children and pregnant people. So the vast majority of those $9 billion are for Medicaid. So HR1, the quote unquote one big beautiful bill, which I only use that because it is its official title, but it is anything but beautiful. It strips over $900 billion in cuts from Medicaid over 10 years. That's a little more than a 10% cut to the program. It also makes cuts to the Affordable Care Act coverage that are going to lead to higher premiums, higher out-of-pocket costs, and more onerous enrollment for folks. And it also strips almost $300 billion from food security programs, mostly from SNAP or food stamps. So very high level, that is what we're looking at. And as you all know, this bill essentially was argued to pass in order to extend the Trump tax cuts from the first administration that overwhelmingly benefit the wealthiest and extend additional corporate and business tax breaks. And that's what led to the over $1 billion shortfall in our state budget that we had to call a special session for just recently, that Senator Marchman and us and many others are recovering from. But really all of the cuts in this bill are starting off hitting the Affordable Care Act side. So essentially in HR1, Republicans counted on the enhanced premium tax credits that started during COVID. They made health insurance much more affordable under the Affordable Care Act. Regardless of your perspective on whether we should be financing private insurance, it helped at least 100,000 Coloradans get coverage. They essentially accounted for that going away as part of the savings that they were counting in HR1. And if these enhanced premium tax credits expire at the end of the year, it is going to lead to massive pain and huge premium spikes for Coloradans when they go to enroll starting on November 1st. So it does two primary things. One, it reinstates the tax credit cliff for those people who are above 400% of the federal poverty level. That is about 36,000 Coloradans that will lose access to any financial assistance overnight. And those Coloradans who continue to be eligible for tax credits under the ACA will see average net premium increases of over 170%. This is happening because the market instability that is being created by these tax credits expiring means that we're going to lose roughly 100,000 Coloradans from the individual market of about 300,000, so nearly a third. And that is leading to the insurers filing the largest rate increases that we've seen in quite a few years, 28% on average statewide, 38% in rural areas. And so you're seeing financial assistance go down as premiums are spiking. And that is what is going to lead to these massive premium spikes for folks enrolling through Connect for Health Colorado. We did do some work during the special legislative session under House Bill 25B 1006 to blunt some of these cuts. But the reality is we were able to secure about $100 million for affordability programs that we have created at the state level. And that is nowhere near enough to offset the loss of these enhanced premium tax credits. Roughly, they total around $230 million in tax increase with the loss of the tax credits for folks. So we're only offsetting a portion of that. We've also seen Rocky Mountain Health Plans and Anthem say that they're planning to withdraw some of their plans from areas of the state, potentially forcing 96,000 Coloradans to shift health insurer and their plans. And anytime a shakeup like this happens, we always see people lose coverage because many people like their insurer, like their insurance plan, or get sort of stuck with that, and they auto-renew most of the time. There's some additional cuts to the ACA that are sort of on the horizon. There was a federal rule that was going to create sort of lower value plans under the ACA, also lead to some increases in premiums and out-of-pocket costs and add some additional barriers. That is currently blocked in the courts. We'll see what happens there. But starting in 2027, many documented immigrants will no longer be eligible for tax credits under the ACA, and this includes refugees, asylees, victims of trafficking, violence, and domestic abuse. And this also coincides with those same populations being prevented from enrolling in Medicaid as well. So they are essentially opt out of the coverage options that we have available. Shifting over to the Medicaid side, Colorado Medicaid covers over 1.1 million Coloradans. It covers 61% of the people who live in nursing homes in our state, covers 44% of births, averages about 40% of children have coverage through Medicaid. And in 55 of 64 counties in the state, 20% or more of the population is covered through Medicaid. So it is fundamental to how our healthcare system operates. And so if you cut that system by roughly 10%, it's going to have drastic consequences. So some of the cuts that I'm gonna go through the cuts to Medicaid in sort of a chronological fashion. The first and most immediate was that it prevented Planned Parenthood from receiving federal funds. Essentially, it prohibited them from taking Medicaid dollars. This was also addressed in the special session just recently, so we found sort of workarounds so that Planned Parenthood can continue to provide services to this population. And then the cuts on the Medicaid side really start at the end of 2026 or January 1st, 2027, essentially. And the biggest impacts are going to come from work requirements at that point in time. These are needless administrative barriers. We're talking about, and these would apply to essentially the Medicaid expansion population from the Affordable Care Act. That's 367,000 Coloradans who will be subject to these requirements. We saw how well our Medicaid system didn't do at the end of the public health emergency and keeping people enrolled. We saw huge losses in coverage, and a lot of that is due to administrative barrier. this is just going to add red tape for folks. And those people who are not subject to the work requirements will also have to essentially prove they meet some kind of exemption. So on the low end, the anticipation is that we'll lose another 100,000 Coloradans from coverage. We also anticipate that loss in coverage is going to mean we draw in $735 million in federal funds a year. We'll lose 7,500 jobs, nearly $1 billion in state GDP, and it will add nearly $60 million a year in cost just to administer the work requirements. And people who fail to qualify for Medicaid because of the work requirements will also be deemed ineligible for ACA tax credits. So they won't have another coverage option. A few additional cuts that start in 2027. Instead of folks having to go through the redetermination process for Medicaid every 12 months, it's going to be every 6 months. There's not really a good rationale for this. It just adds another administrative hurdle for folks. And as I talked about a minute ago, we're going to see refugees, asylees, and victims of trafficking and domestic abuse lose coverage as well. Another sort of nuance that starts in 2027 is Medicaid can cover folks retroactively currently for up to 3 months, 90 days. That is getting trimmed back depending on the population to 1 or 2 months. And what ultimately this is going to mean is more Coloradans are going to end up in medical debt and financial insecurity because they might miss the window to get Medicaid to help cover a bill that they were eligible for. And again, while all of these administrative barriers, work requirements, and more frequent Medicaid redeterminations are really targeting that Medicaid expansion population, folks who fall in other categories of Medicaid, whether they have disability, they have long-term care services, they're a child, they're going to have to provide some additional paperwork to prove that they don't need to meet the work requirements. And then the cuts get unfortunately worse starting in 2028 for our state. Many states use a provider fee or tax to help fund a portion of their Medicaid program. In Colorado, we have a hospital provider fee that funds Medicaid coverage for 427,000 Coloradans. This incorporates all of our Medicaid expansion population plus the Medicaid buy-in program for adults with disabilities, provides a chunk of the coverage for our CHIP program for kids. And so we're all told these programs are facing cuts starting in 2028 because we are no longer going to be able to bring in the same amount through a fee that is going to ultimately be cut over several years by almost half. And that means that by about 2030, Colorado will lose somewhere in the realm of $1.5 to $3 billion a year in Medicaid funding. So if you think back to one of my earlier slides where we get a little over $9 billion from the federal government, we could see that cut by a third just from this mechanism alone. To add insult to injury, starting in 2028, states will be forced to require up to $35 copays for some services within the Medicaid program for anybody who is above 100% of the federal poverty level. That is an individual making just over $15,650 a year. If you think somebody with that income level is going to be able to afford a $35 copay, we all know how that's going to go. They are going to delay care until it is an emergency, and then it is much more costly for everybody. There are some categories of care that will be exempt from this requirement, including primary care, most mental health and substance use treatments, pregnancy, inpatient and emergency care. We did a lot to try to prevent HR1 from passing. I had the, I guess, honor and dubious honor, I guess, in some respects, of running our Protect Our Care Colorado coalition and campaign back in 2017 when ACA repeal was a threat. We did the same. We resurrected that for this fight. We were unfortunately not successful in preventing it, but you can see just by congressional district how much Medicaid means for each congressional district as a portion of monthly Medicaid enrollees on average, and the annual funding that goes to those districts. Looking at the overall impact, it is hard to put an exact number on how much funding we will lose, because some of it depends on the implementation of work requirements, some of it depends on the decisions that are made around the coverage programs from our hospital provider fee. So consider these numbers the minimum of the cuts that we will see. In reality, we are likely to see significantly more. So we know that Colorado is going to lose at least $2 billion a year by 2030, and we know that at least 200,000 Coloradans are estimated to lose coverage over the next few years. This is all going to lead to our uninsured rate spiking. That's going to lead to more uncompensated care. We're going to see Coloradans turning on and off of Medicaid more frequently, or getting locked out because of work requirements. Many immigrants, both documented and undocumented, will be locked out of coverage. And a lot of the optional Medicaid programs that we have put in place in our state to try to expand coverage, improve coverage in the Medicaid program, will be at extreme risk. That includes the Medicaid expansion under the Affordable Care Act, the Medicaid buy-in for people with disabilities, home-based care services for older adults and people with disabilities, Medicaid adult dental coverage. Coverage for enhancements for kids and pregnant persons will go away. And also could lead to cuts to the Cover All Coloradans program that just covers kids and pregnant people who are all of this is going to have a huge impact on our healthcare system as a whole. Hospitals, clinics, and providers, I think, are likely to reduce services or be closed or forced to be closed altogether. It's especially true in rural areas, but it is not totally restricted to rural areas. I think we are likely to see similar impacts of reduced services even here in the metro area, because hospitals and clinics and providers will have to pick and choose what they can do with substantially less funding and a significant increase in the uninsured. It is also going to have a huge economic impact. An analysis from the Colorado Health Foundation found that for every $1 million we lose in federal Medicaid funding, we lose $2.25 million in economic activity and an additional $825,000 in household earnings. And thousands of jobs will be put at risk because of this. So essentially where this leaves Colorado is we will either be forced to make progressively deeper cuts to Medicaid coverage while ACA enrollments plummet and there is less assistance available, or we have to innovate and create new coverage, funding, and finance structures. And that is what Senator Marchman is going to talk a little bit about. We have worked extensively on some of these proposals and are really trying to figure out what a new vision for Colorado's healthcare system can look like so that we can provide a healthcare system that meets the needs for everybody in our state and doesn't leave people out. So I will turn it over to Senator Marchman or back to Kathy before that.
Timing.
Scary, okay? Scary and sad. So right now, I'd like to, the solution is coming up, and I'm going to 2-minute video that's going to kind of give you an idea of what it's like, what it would be like to live under a single-payer universal healthcare system. Taylor?
Welcome to a vision of healthcare that includes everyone. Yes, everyone. Imagine a world where every Coloradan can access the care they need without hurdles or financial strain. Join us in making this vision a reality. Imagine this. All your medical needs are met without hassle or expense when you visit your provider. Ears, eyes, teeth, and mental health. Because the last time we checked, these are all part of our bodies. Imagine you can grow old knowing you'll have the care you need when, where, and however long you need it without breaking the bank. Imagine you and your healthcare provider deciding the care you'll receive. You spend your time getting healthy, not jumping through hoops. And imagine you'll be free to choose your medical provider. No more in and out of network. Imagine as a Coloradan, you can be assured you'll receive the health care you need when you need it. Imagine your health care premiums will be based on your ability to pay. Imagine deductibles and copays are a thing of the past. No more barriers to healthcare due to financial hardship. Imagine you will receive fair drug and hospital prices as well as fair payments to healthcare providers. Imagine all Coloradans will have one nonprofit agency that pays for the healthcare of all. Imagine there are no middlemen, just you and your provider deciding what is best for you. Imagine a future where Colorado leads the way, inspiring other states to follow. Let's work together to make healthcare for every Coloradan a reality. Join us in supporting or volunteering for this cause. Together, we can create a healthier, more equitable society.
No, I can try and share. We're at the stage now where my favorite password is what could go wrong.
Oh, I think you got it.
Yeah, that's it.
All right. Well, I appreciate it. And I just want to say thank you. It is so exciting to be able to see and hear all of what's going on in Arvada. I wish, living in Loveland, that we had something like Arvadans for progressive action, and I'm really inspired by this. I also want to thank Kathy for the invitation, and then a huge thank you to Ashley, who helped prepare the presentation, get updates, and coordinate the logistics, and she's here on a Saturday afternoon. So I just want to say that, but I'm going to start with my presentation, just kind of to echo what we heard from Adam. What has happened with HR1 is certainly incredibly impactful, but I just want to place it for us. It has been 15 years since Obamacare passed. So we have spent 15 years, 11 years with it fully in place. And it's survived 3 presidencies, and the goal was to increase access and improvements, just like we heard Adam say. And it has been incredibly successful. We've cut our uninsured from, in 2010, it was 18% nationwide, down to 7% in 2023. So it was incredibly effective. We expanded Medicaid in red and blue states, 40 plus states did this. We funded the community health centers that support so many Coloradans, did a lot for rural care, the marketplace subsidies, and we created the federal framework to create options like the Colorado option. And now to be faced with a presidency and a federal government that is no longer prioritizing access and quality in healthcare is challenging, to say the least. So, Adam, thanks for your tenacity in that presentation. It's hard to get up there and present those things, and as hard as it is the truth. November, we anticipate big issues. And so I just kind of wanted to frame what SB 25045 is, kind of in the realm of some of these federal issues. So, what this does is it's going to help us prepare for the loss of the federal subsidies. I'm going to go through what the bill does, but it basically does an incredible fiscal impact on local systems. How does the Colorado option, how could we leverage that to maintain care, access, and accessibility? So that's one thing that this is in direct relation to HR 1. The other thing it does is it evaluates income-based progressive funding options, so that we, if we need to, can replace ACA tax credit or these Medicaid expansion dollars. It centers equity, whereas we're seeing in the federal government, that's another thing that for years has been a priority of our federal government. It is no longer. And this is something that this proposal does. And more importantly, and most importantly, maybe, is it builds a local public alternative. When we see the federal government basically pulling back on everything that we've been doing for a couple of decades, at least, it's a problem. So let me get into the presentation. Thank you, Ashley, for preparing these slides. They look great. So what this universal healthcare system, the bill we passed in this past session, and I was lucky to be on it for 2 years, but this was a 3 times a charm kind of bill, and we were really excited to get it through. But it was a labor of love, and couldn't have done it without the work of all of the supporters and the collaboratives. So the first thing that this does is it created model legislation, which has been drafted. It was not drafted in a vacuum. Like I said, it was a collaborative, various stakeholders, and they came up with a 20-page bill. So that draft policy is basically what they're going to study now. That was how we set the bill up, is go set a policy up by July and then study it. And that's what's happening. So the Colorado School of Public Health is going to be doing this rigorous analysis I was just talking about. They're going to talk about costs, revenue mechanisms, and just the overall feasibility of a type of system like this. Their findings are going to be due end of December 26. So we come back to session January 27. We should have a comprehensive report and recommendations delivered to the lawmakers ready to go. So it does create the first truly rigorous analysis of universal health care in Colorado. We are working on fundraising $750,000 to execute the study. Model legislation is out. And again, like I said, this is our 3rd time. So we are happy to get this guy through this year. And it was bipartisan. We had one Republican senator, who is now the minority leader, Senator Cleve Simpson, voted in favor of this bill. So this bill passed in a bipartisan way. So let's go to the next slide, please. There, thank you. So let's look at some of the progress the Alliance has made, and what the health policy and systems analysis covers. So first is our website and model legislation. The Colorado Healthcare Policy Alliance website is now live, and the draft single payer legislation that I said was 20 pages, it's up and going. So it's posted as of July 1. Regarding the features of the universal system, it's designed to be a single payer, nonprofit, and publicly financed system. So it offers comprehensive benefits, including medical, dental, vision, mental health, and long-term care. A key principle is patient choice. Individuals can choose any participating provider. Premiums will be based on ability to pay, and there will be no deductibles, no co-payments. We're also exploring fair provider payments and innovative methods like global budgeting. So the scope and timeline of the actual study is really broad. The analysis is first going to estimate the costs for the first, second, fifth, and 10th year of implementation. We know that as we roll this out, just like as we rolled out the Colorado option and Obamacare across the country, you do little pieces and then you come back and do more and more. So we know it's going to change. So that's part of the part of what we're going to look at. It is also going to analyze healthcare expenditures by source and assess the impacts on rural communities, various demographics, racial, ethnic, and socioeconomic. We're also going to evaluate the effects on hospitals, clinics, providers, the insurance and pharmaceutical industries, and even the wider economy. Additionally, the study is going to compare alternative models, such as an expanded Colorado option. We added that in the language. We've already got a basis. Maybe we expand it to do something like this. And again, like I said, that report is due December 31st of 2026. And they are going to begin meeting. It's an analysis collaborative group. It was established by HICPUF, who Adam just spoke about. Has really broad stakeholder representation. It's 20 folks, and we spelled out what types of folks, like a representative from this, a representative from that, would be in this collaborative. And so they are going to begin meeting later this year, and they're going to be advisors on the project. Let's go to the next slide, please. Okay, so let me update you a little bit on funding. We, as I said, have to raise $750,000, and we're off to a really strong start. The first Zoom fundraiser was held on August 26th, and a very generous donor offered a $100,000 matching gift challenge before the event even started. So following that, a second donor offered another $100,000 matching challenge. We'd already raised approximately $30,000 through online donations before the event, and we anticipate additional funds from the August 26th fundraiser. Our next fundraiser is planned for late September, and it's really important to remember that the study requires, $750,000, thinking like $750,000, so it's $760 really, but rounding down. So we really need to keep fundraising, and this community support is really important. I think the tie-in with HR 1, the look at Medicaid really getting decimated, and looking at how we want to separate ourselves from the atrocious federal policies that Trump has brought, I can see this really being something that we'll be able to do good fundraising off of, get a great report, and hopefully be able to ride this in to something in 2027. So let me talk about a couple of timelines. The model legislation was published on July 1st. On the 1st of August, HICPUF invited members to join the collaborative. The collaborative is going to meet at least twice through October 1st, 2026. That was one of the things that we had to really kind of skimp on, is we didn't give the collaborative decision making, they're advising, and we're not paying to have them have meetings. So that was kind of one of the negotiation points in the bill. They're not meeting as much as we'd like them to, but they're an active group, and so they're going to stay involved even though they're only doing a couple of meetings. And then the Colorado School of Public Health, like I said, has to submit their final report December 30th. The research team leading this analysis includes Bradley, Mays, Tung, McManus, and Leiker. They will be utilizing advanced techniques, including big data and microsimulation methods, to estimate costs, analyze impacts on the different communities and stakeholders, and compare various alternative models. When we created this bill, one of the things that the Colorado Public Health School wanted was to make sure they could do these micro simulations, because long-term services and support is such an expensive part, but such an important and integral part of the healthcare process, that that's the part they really needed, that advanced micro simulation. So that was a good thing that we got in the bill. There was a lot that we had to take out. That was something I was really excited about. So let's go to the last slide on the universal healthcare. So, why universal health care? I didn't get to hear that presentation. I want to go look at it. But the simple truth is that in Colorado and across the US, we spend twice as much on healthcare as most of the industrialized world. Yet we consistently achieve the worst health outcomes. We're clearly not getting a good deal for our health or our wallets. But there is significant opportunity for us to do better. A universal system can leverage larger risk pools while importantly maintaining private delivery of care. This means patients still get to choose their private providers. Furthermore, universal healthcare would genuinely save Colorado businesses money and significantly help entrepreneurs who are currently burdened by high healthcare costs. As Governor Polis has also noted, this approach offers efficiency and economic benefits. So let's break down the key advantages. First, lower costs. Through bulk purchasing of medications and services and simplified administration, we can significantly reduce our spending. The second is better outcomes. Universal access to care fundamentally improves population health by ensuring everyone can get the care they need when they need it, instead of waiting to go to emergency care because they can't afford a $35 copay when they only make $16,000 a year. Makes sense. The third is equity. Coverage is going to be based on need, not tied to employment or income. So it ensures that everyone has access. And finally, it's innovative. A state funding model fosters preventative care and encourages innovation in how we deliver healthcare services. So let's go to the last slide.
The last one's about you.
Oh, cool. Awesome. Well, that should be easy. So I just really appreciate you guys having me. I was elected in 2022. I represent SD 15. We've been talking a lot about redistricting. When the nonpartisan redistricting committee changed the maps after the 2020 census, they created my district as a new district as a 50-50 district. So I am the first woman to have held this seat. I beat a Republican incumbent, and this is 3/4 Larimer County and 1/4 Boulder County, and I lost in Larimer County. So I'm a math teacher, so you can tell how much support I got in Boulder County. And I'm hoping that after, 4 years of service, I can win in Larimer County, but that's kind of my deal. So I get to serve as the vice chair on education and on finance in the Senate. I chair our water and ag resources interim committee, and I'm also in the joint technology committee. I've got a systems engineering degree from Georgia Tech. Cheered for them last week at CU, and they won, which was cool. But yeah, I got to stay home with my kids. I used to serve on the school board, and then I went back to be a teacher, and that's what I'm doing now. But yeah, I'm a huge champion for progressive values. It looks like it's going to be a rematch next year between me and the Republican millionaire who I unseated in 2022, and I am here for it. So thank you guys for having me. I really meant to be there today, but just ended up having 3 different things going on in 3 different towns. And so apologies for not being there in person, but ready for questions and hopefully I'll have answers.
Marchman. Questions from the audience here? Let's see, Bob?
I read about efforts by Governor Newsom and some of the governors in the Northeast to form these alliances on the West Coast and the East Coast for healthcare. And I somehow read that our Governor Polis has helped us to still have access to vaccines like the COVID vaccine. Will this bill, or is there any efforts in Colorado to consider joining up with these alliances in other states? Or is that something that we should consider?
Let's see.
I'm happy to start. We have not seen any proposals for sort of joining some kind of multi-state compact on healthcare. I think the challenge is Colorado is a blue state largely surrounded by red states, and that makes just sort of the lack of contiguous contact that creates some potential challenges for that kind of approach. I think
Mexico.
Yes. There are, I hesitate to bring this up because I don't think it's terribly realistic, but under the Affordable Care Act, there is something called a 1333 waiver that allows states to form multi-state compacts. Right now, most of the talk around those are in the vein of red states compacting together to undermine healthcare, but it could potentially be used in the other direction. The challenge is it requires each state to give up a level of control, and it has to be shared control. And that is a tough sell a lot of times with elected officials.
And then I'll just add to that we are looking at legislation to point to something other than a federal board going forward. I was trying to figure out, we ran a bill last year that did this for a small segment of things, and the folks who did it were updating our caucus about what they're bringing next year. And I wasn't able to get quick answers, so I apologize for that. But people are in fact working, perhaps not like what Adam said, maybe not the compact, and maybe not the Western thing, but we are definitely looking to get out from under the federal guidance that we are required to follow. So I do believe that our governor is going to be supportive of that.
And I think just another point on the vaccine question, we did pass legislation that allows us to sort of sustain vaccine access sort of under the ACA guidelines and point to sort of a state medical and nursing board recommendation rather than the federal panels.
That was it.
Will the insurance companies go along with that?
So yes, I would say they will, because I don't think they have had really a problem doing that up until this point. And vaccines end up actually saving higher healthcare costs for them in the long run. It's a no-brainer really in the healthcare space. Like if you vaccinate people, you're saving significant costs and health impacts down the line. Some of the insurers might try to game things here and there, but that is one thing that we have not received real pushback on.
Okay, you in the back.
Other states have tried to do a universal payer thing, and from what I understand, without having really studied the matter intensively, some have been more successful than others. How much study has been done about what's making some of these programs succeed and others not succeed as well, or actually fail? And how can Colorado stay out of those potholes?
Yeah, I'm sorry, Adam. I was like, yeah, that's my question. But if you want to answer, you're right there. Go.
No, go for it.
I would say that a lot of the work probably was done by Adam. My colleagues, when I came in and ran the bill 2 years ago for the first time, and it failed. Well, it was the second time of the bill, and it failed. There was already a bill that had happened here in Colorado that had a bunch of data. Then they looked at other states to figure out what didn't work and what did. And then they realized universal health care has not been successful in any states. And so, with that knowledge, they said this is as narrow as we can make it, but as broad as we can make sure that it's meaningful. So, I feel like what they handed off to us with, I think it was 1075 and 24, and then 045 last year, I feel like was just the best business practice they could figure out to figure out how can we actually do this, make it implementable, because that is our hope. So, Adam.
I think what I would just add is I think Colorado has created a number of mechanisms that could be leveraged in a universal coverage system. It may not be sort of a straight trajectory to a single payer system. There are other ways that we could start building and laying the foundation that make that leap easier. And so Senator Marchman mentioned the Colorado option, which I led the Consumer Advocacy Coalition around to pass and sit on the advisory board that oversees that. There are some mechanisms in that as far as like controlling healthcare costs that are important that could be expanded or improved. Similarly, we have a prescription drug affordability board at the state level that is about to recommend its first upper payment limit for a drug in October. We're going to get sued for it by pharma, of course. But some of these elements we have created that could be sort of built on, expanded, and help us sort of contain some of the costs and make coverage more affordable in the short term, and probably make it easier to transition to a true single payer universal system.
Thank you. Other questions? Mindy.
I have a question about allies, specifically our 65 counties in Colorado, or organizations like Colorado Counties Inc. Because listening to Jefferson County, which I think almost all of us live in Jeffco, they are scared to death about the HR1 cuts because it's the counties that provide the human services. They do the Medicaid authorizations, SNAP determinations. It's all on the county staff. And I just wondered if you're reaching out and saying, hey, come on now, join us and help support this.
Yeah, so we worked a lot with CCAT, which is counties and commissioners acting together, I think, or I'm forgetting the exact acronym, a lot as part of our Protect Our Care Colorado coalition. And they are still very engaged. And I think we've seen some counties and particularly their public health department be more engaged than others. But I think to your point, that almost $60 million that's going to be added in administrative costs, that's almost all at the county level. Essentially, that's an estimate saying we need at least 3,700 more county staff just to process the additional paperwork for Medicaid, not even the additional paperwork for SNAP and things that are getting added. So it is going to cause a huge burden on counties, and I think more and more we're seeing them engage.
And then the tape question. How big of a stumbling block is it to our hope for this system, but also to a coalition if we manage?
Tabor is a big hurdle. I will say one of the things that gives me hope, CCHI is part of a coalition that introduced or filed some ballot measures to at least move Colorado to a graduated income tax that would help alleviate some of the budget constraints under Tabor. It would not totally do away with Tabor, but it's probably the most politically viable path to at least start chewing away at it. That is an effort aiming for the ballot in 2026. So there's a lot of effort in that direction. But Tabor is a huge barrier to anything that is going to require tax changes like a universal system would. We saw this in 2016 with Amendment 69 that would have created a universal system. Tabor basically required that ballot language read at the time, shall taxes be increased by $25 billion to provide a universal healthcare system, and sort of the requirements for ballot language under Tabor basically did not allow space for us to talk about, okay, what does this actually mean for people's pocketbooks? And actually would have led to savings and things like that. There were some challenges with Amendment 69 that go deeper in sort of the policy spectrum from my perspective than sort of how we are approaching things under Senate Bill 45.
Countries that have universal health care tend not to be as litigious as the United States. So they don't sue as much, okay? So what I have not seen any information, and it may be in there, is, they also have caps on how much you can sue. So is there anything to protect, doctors and hospitals and lower their insurance costs, and then also cap what people can receive? Because if that's got to be addressed in this whole, because it's a mindset thing. It's a mindset. And we've got a lot of mindsets to change from equity to funding to suing. I haven't seen anything about
Go ahead, Senator.
Yeah, I'll just say that SB 45 does have some explicit provisions to analyze some of that. So protections and financial stability for doctors, hospitals, and providers. So again, it's not guaranteeing any policy changes because it's a study, but it does make sure that it's looking at what do we need to do in terms of provider reimbursement, equity for rural and safety net providers, and all that kind of stuff. So it does have, and then it also sets in there, let's look at the optional use of the Colorado option as a foundation, which could actually mitigate disruptions. So that's just my thoughts.
And on the group of advisors, they have people from medical people and dental people and, represented, so that could be, that right. They would look at that from their point of view. That's good. Thank you.
Yes, we've got 20 folks. I pulled up the list. We've got the Commissioner of Insurance, we've got the Hospital Association, Organized Labor, Disability Rights, Repro Health, statewide doctors, mental health, a tax policy expert, rural health, nurses, homelessness, dentists, LGBTQ, and then we've got smaller, large employers. So there was a lot of work that went into trying to make that collaborative, as broad to make it a meaningful policy, I guess is what I'd say.
Okay, thank you.
You're welcome.
Go ahead.
This is kind of a strange question, but I'm remembering the recession of about 1980, when I ended up out of work after having been a state employee for a number of years. And I'm looking at it, we're seeing a lot of predictions that there's a recession coming now. And so I'm thinking about doctors trying to pay off their student loans and all these different kinds of things that aren't always taken into consideration when we're looking at laying off a whole huge number of people through the the Trump kind of stuff. And we're not really looking at hiring people. We're looking at people trying to cope on all the different kinds of expenses and stuff, with government employees being laid off again, with other kinds of people being laid off who would normally provide various kinds of services ranging from unemployment compensation to Medicaid to et cetera, et cetera. And I'm just wondering how, or if you guys have been taking that into consideration, because it's something that's coming. And I have no clue at this point how we're going to cope with all of the people who are suddenly finding themselves out of work due to a recession. And that word didn't come up in the whole discussion.
I think it is something that I have a fair amount around, especially when you think about things like work requirements and things like that. If people can't find a job, how are they going to meet those requirements? And therefore, how are they going to have health coverage? And so work requirements are a terrible idea in good economic times. They are absolutely catastrophic in a recession. And how we respond to that, I think, is a real challenge because of TABOR. We don't have sort of the ability and fiscal flexibility that other states will have to a greater extent. No state is going to weather this well, but Colorado is, our hands are tied more than most.
Hi, my name is Rebecca. I'm a candidate for city council, and I would love to know, you had mentioned that some of the issues getting in the way of coming together are giving up local control. So looking ahead, what can we do locally? What are some of the barriers specifically, if you have them, that you're seeing? And how could a candidate or a city council do something impactful in their community?
I think when I was talking about local control, I was meaning more at the state level than I think there are considerations, particularly at the county level, and I think city councilors need to be thinking about this as well and how they engage with county officials and commissioners, because of how work requirements and capacity constraints are likely to play out. Thinking about if there are opportunities for partnership and collaboration that can ease some of those burdens. I think the other thing that we are trying to think through, there's sort of a whole cohort of advocates that are trying to think through at the state level, how can we make the work requirement as least damaging as possible, as least burdensome as possible for folks enrolling? How can we sort of support some of those systems from a technology perspective, but then how can we make sure there's capacity and connections and networks at the ground level to help people? Because technology is not going to help everybody. It's not the only solution we need.
And I'll just add that a lot of this work, like we talked about, happens at the county levels, but city councils can certainly do things. Some cities have passed local resolutions in support of, the values of universal access, cost transparency, workforce stuff. They could also offer pilot sites or local data for the study. You could volunteer your city for early modeling case studies and that kind of stuff. And then another thing that local councils could do would be to have information sessions about universal healthcare. The thing is, we're going to do this study. We're going to get it back at the end of 26. No, who knows what things are going to look like. Top of 27, a bunch new draconian cuts come. Might be a really good time to talk about passing a bill to do this. And we're going to need to have a campaign like none other to make it happen. So why not start early? So Rebecca, congratulations on your candidacy. Good luck. And I would say sharing that, passing a resolution would be a good thing for your community to do.
Thank you.
Yes, thank you.
Fortunately, we are out of time. I just won a couple, well, okay. I just do want to say, how can we help Colorado have affordable, accessible healthcare? And there are things that we all can do. And I have slips of paper that list the things and some contact stuff. And the other one is about single payer and the 10 essentials. So, and there's a couple extra ones on the table if you don't have one. Anyway, you can, some things you can do, talk to your neighbors and friends about the solution. You can join the APA Healthcare Action Team. We meet once a month on Zoom. You can volunteer to be part of the Alliance, grassroots, or fundraising teams. Those Tuesday meetings are open to people that are interested. So if you want to check one out. You can also go to donate to fund the healthcare analysis. And I have information about how to do that. Come up and ask me, because I didn't leave those out there. And you can come to, we're having October 3rd showing of Sick Around the World. And it's in a private home and RSVP, and I'll tell you where it is. Other countries do it, so can we. Thank you to our speakers, Adam and Senator Marchman. And thank you for coming. And